Thursday. Welcome to Something to Talk About Live. My name is Jamie Henkel. My pronouns are she and her, and I am the Learning and Inclusion Manager at PFLAG National. I'm going to be hanging out with you in the comments, in the chat, in all of the places that you are watching today. So if you have any questions, please let us know. And just like every week, we are going to bring in Jean Marie Nevada to host today's conversation. Hi, Jean Marie.
Henkel. We're back together.
We're back together. It's been a couple of weeks too because we were both sick and we were traveling and all sorts of silly stuff. And so it's good to be here.
It is good to be here. Yeah, COVID finally caught up with me. But I have to say, I was very grateful to everybody for telling me, we can actually run a rerun and you can stay in bed, which was a nice nod to self-care at PFLAG.
Absolutely. Well, have fun and I will be back if you need me.
Awesome. Thank you, Jamie. Hey, everybody. My name is Jean Marie Nevada. My pronouns are she and her, if you Spanish, ella. And every single week, well, almost every single week, we get together to talk about something related to LGBTQ equality and inclusion. And this week we are talking about Bisexual Health Month because March is Bisexual Health Month. There are a lot of health disparities, a lot of disparities in general that we can talk about in this space. And I want to get the conversation going. But before we bring our guests in today, I want to make sure that you have the article. So if you want to go to straightforequality.org/STTA live, so something to talk about live, we have posted this week's article that we're using, which is from Medical Express, Claire Mulroy's article, to disclose or not to disclose inside the push for bisexual affirming medical care. And there's some really interesting data in it, including the fact that bisexuals are less likely to be out to people in their lives, and that is because they experience discrimination from both inside and outside of the LGBTQ community. And then when it comes to disclosure to medical providers, those numbers actually are pretty low, and that can be problematic for care plans. So we want to talk about why these disparities exist, how they show up, but most importantly, how we can start changing things up. And to do that, we have two great guests today. So I am going to bring in our guests. First of all, Helen Parshall from the Bisexual Resource Center, where she is a board member. Hello, Helen.
Hello. It is lovely to see you again.
Always good to see you. I'm so happy that you're here.
Yeah, I am also new to doing live shows, so feel free to just stop me in my tracks if I roll in.
We encourage you to keep talking, and let's bring Mackenzie in. So Mackenzie from PFLAG National, from our Straight for Equality team. Hello, Mackenzie, returning guest.
Hey, Helen. Good to see both of you.
Thank you both for being here. I'm really excited about this conversation because I think particularly for the past 2 years, as the data has come out about how people in the LGBTQ community identify, and we've seen those numbers of people who identify as bi constantly coming to the top of the list, it has made a lot of people start having conversations about bi identities in ways that I don't think that they have in the past. And I think taking a lot more seriously than it ever was in the past. So before we get really into this, Helen, you work with the Bisexual Resource Center, which does spearhead the Bisexual Health campaign every March. Could you talk a little bit about why the campaign exists and what the campaign is doing?
Absolutely. So this year is actually a special year because it's the 10th annual Bi Health Month. And it started because there are all of these health disparities and nobody was talking about them, right? Nobody was connected to each other, even within the Bi Plus community. And I had the special privilege of working with Ellen Ruthstrom, who's a longtime bisexual advocate, to learn a little bit more about how Bi Health Month started. And it was with a simple slogan: by the way, our health matters too, right? Because it does. And I've got my t-shirts. So I'm here, I'm very visible. And our theme 10 years later is beyond visibility, because as we start talking about more of these disparities, we start talking about bi identities, but what are we doing about it, right? It's cool, we're here, we exist, that is new and exciting, but what are we doing to support and connect bi plus people? And Bi Health Month is a way of bringing us all together to push for change, but also to support each other, because sometimes it can be pretty lonely when you don't know anybody else who feels like you do at all. And that's why Bi Health Month is really important.
Yeah, and thank you for that. I didn't realize it had been 10 years of doing this. Also, I do need to compliment the community on definitely the best plays on words of all of the LGBTQ individuals. You really do win hands down. But I know we're poking a little bit of fun at some of this. But the bottom line is invisibility remains a huge issue. And that is not a random thing. And that is not a shortcoming on the part of people who are bi. it has to do with a lot of what you experience when you do come out to people. So Mackenzie, you and I spent a lot of time talking about allyship. You've done a lot of work, especially in the spaces of creating more allies to the bi plus community. So could you talk a little bit about how allies can take part in these conversations? Because I think part of the situation here right away off the bat is people just don't know what's going on.
Absolutely. And you know probably even better than I do about the importance of learning and education, because that is what we do. We try to help allies come on board and help them continue to expand their knowledge base for the entire LGBTQ plus community, as well as other marginalized communities. So I think that making sure that there is a level of education that is happening is really vital on behalf of people who want to support the bi community. Taking the time to learn is really, really important. I think that being able to have conversations as an ally to the bi plus community is one of the most important and helpful things that allies can do, because like you just said, this is an under-discussed topic. We do talk about health disparities in general. Most of that is already under-discussed, and we even talk less about health disparities for bi plus people. And so as allies take their time to learn and to speak up, that I think is a really helpful first step, because that means that more people are going to be hearing about these situations and saying, wow, I didn't know that. That is not good. I want to learn more as well. And I think that one key reason for that is because while people might not necessarily know that they know someone who is bi plus, they're likely going to know someone in their life who is an ally and might be able to listen to them and have those conversations. And those, by speaking up as an ally, those conversations will be existing in spaces where they might not currently exist, which creates a positive cycle of change, because as you talk more, people hear more, and then those people are going to talk more, therefore reaching more people. And so I know I come at this from an education perspective, but I do think that starting to learn and then being comfortable having those conversations and helping other people start to learn is a really, really great entry step for allies who want to be part of this conversation.
I think you're absolutely right. And I don't think that coming at it from an educational standpoint is the wrong one, because I think so much, and you've taught me so much of this, is of what is being faced is misinformation, is misunderstanding, is sometimes just frankly heels dug in bias that people are afraid to let go of. And it exists inside and outside of the community. And I just think, especially for those of us who identify as queer, using the privilege that we have to put some of that in check, and talking about our own journeys, of which I have had, is so, so important. So the article that we shared today does discuss some of the disparities that bi plus people face, really focusing on healthcare aspects. So for example, the low number of people who will disclose to a healthcare provider that they are bi plus identified, and how that actually does connect then to not as good care, because you're not addressing the whole patient. So maybe, Helen, we can start with you. Mackenzie, I'd like to hear if you have any examples of this. Can you talk about how some of these disparities show up and what some of the ways that we can address them are?
Yeah, so when we look at the statistics, it's honestly kind of bleak and really sad to see just how much higher the rates of mood disorders are within the bi plus community. And that's when you compare it against lesbian and gay folks, as well as when you compare it against straight folks. It's just simply worse. And that includes substance use disorder, HIV. All of these things are so much harder for bi plus folks, especially when we don't feel safe enough to disclose parts of our identity, because then we're not getting care for our whole person. And I work by day at AIDS United, which is an HIV organization. And one of my challenges just in my day job really has been that there's not even research disaggregated for bi plus identities when you talk about HIV. It's lumped into a broader gay and bisexual men category. But there's also bi plus trans folks who are living with HIV, and you can't talk about these issues until you look at the whole person. And it's hard. And one of the challenges even just of running Bi Health Month really is like all of the statistics and things that we're talking about are really kind of scary. And it can feel really isolating when you're going through it too. And so just part of our work really starts by breaking down the data and making bi plus folks visible at all. Because until you see bi plus folks when you talk about these health issues, you're not able to help us at all.
Yeah, and when you talk about those statistics, just for people who haven't seen the article, it said that about 39% of bi men and 33% of bi women said that they did not disclose their sexuality to their medical provider. But just to do the contrast that you were just talking about, Helen, that number is 10% for gay men and 13% for lesbians, respectively. So there is a huge, huge difference there. And then it ties into so much about this. Mackenzie, do you want to build on when Helen started talking about the disparities, talking about the problematic data too?
Absolutely. So one thing that I do want to mention is that oftentimes these conversations about disclosure and coming out are kind of framed around individual choice, but we do see that there are situations where one, it might not be safe for a bi plus person to come out, and then other situations where they might not even have the opportunity, or the question might not even be asked, or it might not be recorded properly. We talk about in some of our trainings that coming out is not a one-time process for anyone. People often are coming out regularly, regardless of what sexual orientation or gender identity they have, depending on spaces that they're in. But we see that is even more true for bi plus people, because we often see situations where someone will come out as bi, and then the next time they are in a relationship, people might assume that they're either gay or straight, or time goes by and people assume, oh, that was just a phase. And just those really insidious talking points we often hear. But I think that what Helen was saying about looking at the whole person is so vital. I think that our healthcare system is kind of broken apart in different ways, and it's rare that we are getting holistic care, that we are seeing someone who's going to look at every different thing happening. Take for example, most health insurance plans, you get medical insurance, and then you have to get additional dental or eye insurance or mental health, whereas they all go hand in hand. And so when Helen is talking about the mood disorders that bi plus people face, when we see that bi plus people are at higher risk of abuse or intimate partner violence, or being ostracized by other communities, those all go hand in hand, but they are not necessarily looked at as hand in hand. And so I think that one of the major things that we face, one of the major challenges that we face, is that people in healthcare are not necessarily being trained properly to look at all of these different aspects and seeing how they come together. And I think some of that is just the structural bias that exists. And I think some of it is the misinformation, like you mentioned, Jean Marie, that there are so many incorrect ideas about bisexuality. And that is definitely going to be something that no one is immune to, because many people are hearing it. People are going to be hearing it as they go to school to be in healthcare and everything along those lines. And it's not just bisexuality. We do see this with racial bias. We see this with gender bias. We see this with weight bias. We see it kind of across the board. And so what that does in turn is creates a negative cycle where healthcare professionals are not necessarily looking at where they need to be looking, and understanding that, bi plus identities do intersect with other identities. And also, when we are aware of these disparities in the way that we are treated and everything along those lines, that things often fall together in a way that should be addressed in our healthcare.
Yeah, I really appreciate that. And I like the connecting of the dots on this one, because I think we often do see, we even see in terms of healthcare, physical healthcare and mental healthcare as two separate entities, when in fact the two really should be getting considered together. But it also requires practitioners on both sides of that conversation to be behaving and functioning in an inclusive way, communicating in an inclusive way. And there's so many ways that I think people get shut down really early. So I definitely do not want to stay completely on the negative things. I would love to hear about where things go right. And if you have an example for me, and I know that this is an if, can either of you talk to me a little bit about an example where you've had a good experience with an affirming healthcare provider? What did that mean for you in terms of the experience? How did it feel? What were some of those outcomes? And maybe how did it differ from past experiences that didn't go as well? And I will let whoever wants to jump in on this one go first.
I can start because I actually consider myself very lucky to have found a mental health care therapist who is also bi plus, right? And so that is like a unicorn needle in a haystack type moment. But being able to have that shared understanding when I talk about my romantic life, my dating life, my sexual health, when I just process my anxiety, having that not just be something that like she is aware of, but she knows on that deep, fundamental, personal level, has really transformed my mental health care experience, because it can be really hard to educate your healthcare provider on who you are, particularly when you're already seeing someone for the anxiety and depression that you're navigating, and there's just like a lot happening inside you. To have that weight lifted has really, it's been transformative for me. And our friends, we work really closely with Still Bisexual, an organization during Bi Health Month, and they're putting together some resources for Bi Plus therapists. They're trying to make a directory. Check them out too, because I know I can speak for me personally. Like, it has been life-changing in how I've learned to live and navigate my own anxiety and depression, having that type of support.
I'm so glad that you're having that experience, because we hear so many of stories on the other side of that. And I think to hear somebody say it has actually been life-changing is a pretty significant statement. Mackenzie, what about you?
So a couple of things I remember, and I think I've told this story on the show before, so I'll try to keep it light. But I had a doctor a few years ago, back when I lived in a different state, so she's no longer my doctor, but she asked me a question saying, you know, if you were looking for relations or relationships, would you be looking for relationships with women, men, both? Which obviously isn't the best way in regards to the gender binary to ask that question. But the way she phrased it allowed me to say, oh, both plus. As compared to previous experiences I had had where doctors would ask questions like, oh, do you have a girlfriend? And I didn't have a girlfriend. And then they'd switch and say, oh, do you have a boyfriend? And I didn't have a boyfriend. And then that was the end of the conversations. They were not directly asking the questions that they needed to ask. I will also note, though, that it's not just about my bi plus identity where I've had good and bad experiences in healthcare. I recently went to my doctor for my yearly physical, and he said something to me like, oh, you're a savvy young person. I understand that. I don't need to explain this to you because I know that you get it, because he listened to the way that I was speaking, as compared to a doctor several years ago that I went to who explained a certain medication that I knew all about. I had done a lot of reading about it. I knew it was not necessarily for the lifestyle that I had at the time. It was just not for me. And then he said, well, let me just explain it to you anyway. Gave me talked for about 5 minutes, all about this medication that I knew I didn't need. And I had showed that I had knowledge about it. It's not like I said, oh, no, I don't want to hear about it. I said, no, I know I don't need this because of XYZ reasons. And so having healthcare professionals that are going to be asking the proper questions, like my one doctor that I mentioned, as well as being there to listen and to understand and to hear everything that you're saying, regardless of identity, being inclusive in how they're speaking with you is just absolutely vital. And it's really affirming when you have those good experiences, and it can be really unpleasant when you don't, even if you have knowledge and you have an understanding and you can still navigate it. It's just so much better when a doctor or a healthcare professional knows what to do right off the bat, so that way you feel more welcome right away.
And I think, thank you for that. And I think one of the other pieces of it is affirmatively being able to behave in an inclusive way, but also being knowledgeable. I know that one of the things, and I think that this article actually mentioned it, is there is this stereotype of bisexual equals promiscuous. And there is that assumption of promiscuity. And that's literally where healthcare providers can start the conversation, which may or may not be the case. There is no correlation between the two. I mean, anybody can or can't be, if we want to use the word promiscuous. But I think that there's also sort of the negative information that needs to be fought too. So, and Helen, we can start with you on this one. What are some of the opportunities where we can improve Bi Plus healthcare? So what are some things that providers can be doing? We've talked a little bit about how questions are being asked, but what else, getting it into some of the details?
Mackenzie touched on it a little bit, and I just want to expand on it. And I think it starts with listening, right? Listening to what we're saying, because sometimes I know I found myself speaking in coded ways that, like, if a provider is listening for, they know to ask more questions, right? So when I start a new healthcare provider relationship, sometimes I will use gender neutral pronouns in how I talk about things, just because I'm very single right now. I'm not very sexually active. So I default to that very neutral place. And I once had a doctor ask me, okay, so like, I hear this. Am I picking that up correctly? Like, are you saying that you're queer? And I said, yes, because they were actively listening and not just making assumptions on what they think they knew about me. Because conversely, I've had folks not listen to me at all and go, oh, you're on the pill, so you must be sexually active. I'm not. I'm on the pill for health reasons right now. And that's an entirely different story of who I am as a bi plus person seeking care. And just listening can transform a relationship, I think, because when you take the time to listen before assuming, you learn so much. And even if you don't have all the answers yourself as the provider, you can start asking questions that make us feel safe to maybe do a little bit more of that education than we'd like. But it feels like we know that it's going to be received well and positively because there's that openness to the interaction at all.
Yeah, there's that signaling, and it starts with the listening. It's followed by the way you're interacting. Absolutely. Mackenzie, any suggestions for you that you want to build on?
I think that everything Helen said makes the most sense. I think listening, and I think genuine curiosity about your patients is really important, because there are just so many things that can be going on that, the patient might not be comfortable addressing something that might be really important, or the patient might not know how to address something. So it's about safety, but also about being willing to kind of take that time. And I know that we're still in a public health crisis when it comes to the pandemic, as well as other health issues. So doctors are often overworked and are often trying to get through things quickly so they can help as many people as possible. And I totally understand that. But when a doctor is taking the time to get to know a patient and wanting to hear more, wanting to learn about everything and addressing some of these different identities, different situations, is really, really affirming. And that's the best way that you're going to be able to get care. I also do think that taking the time for healthcare professionals to learn more about the disparities that bi+ people face, as well as marginalized communities in general, but making that active choice to say, okay, I want to learn more about this and why this is, and being able to be there so they can kind of look at their own bias or look at bias that might be there. For example, I know that the bi+ community, particularly bi+ men, are often kind of grouped in with AIDS panic. And that's something that healthcare professionals, if they're aware of, they can kind of say, oh, why am I viewing this bi patient as inherently promiscuous or inherently more likely to have certain infections or diseases or anything like that, and being able to take that step back and say, hold on, let me look at this. And as well as giving healthcare professionals the tools to be able to do that and kind of investigate their own biases. And again, this is more than just bisexuality, but it's something that I think would really have a major impact.
Yeah. I mean, because this is complicated. It's not one thing that you do that changes everything. This is, again, as we talk about allyship, that lifelong ally journey and how it's going to need to evolve as different pieces of this conversation emerge. So, we like to wrap up every single show with stuff that people can do, especially allies. So for people who are not bi-identified or bi+ identified, what are the kind of ways that they can help in interactions with their healthcare providers to build a little bit more inclusion for bi folks? Are there things we should be raising? Are there questions we should be asking? Helen, maybe we can start with you on this one.
Yeah, I mean, I'll jokingly paraphrase the Metro ad I see all the time in DC. If you see something, say something, right? If something lands wrong with you, even if it's not an identity you hold, speak up, because that can go a long way to teaching providers too. And it takes the work off of us to be the ones speaking up all the time, right? I know someone who had a huge amount of trouble getting an Mpox vaccine because the clinic they were at just simply did not understand that as a bi+ person, he was also eligible and at risk for Mpox. And had somebody else in the clinic maybe seen that and seen the guidelines that weren't quite what they needed to be, that could have gone a long way to not forcing this person to disclose in the middle of the front desk office. And I think speak up, because we need everybody in this work and then to help us too, because it's hard.
It is. And I think that is the very definition of using your privilege, that it doesn't directly affect you, but here's your opportunity to use that space that you have. Mackenzie, what about you? What are some of the things that allies should be doing?
Well, just to echo what we kind of talked about at the beginning, I think taking that time to start learning, to keep an eye out and kind of knowing what to say. But I think that there have been some situations that I've been in where I have used my place either as a queer person or as an ally to another community to speak up. And there have been times where I've failed at that. So, for example, I once went to my college health clinic for something, And that day I had a rainbow pin on, and the nurse was talking to me normal, and then she caught the pin, and then she asked me a very sexually invasive question that was not appropriate for what I was in the room for. It was not remotely appropriate, and she genuinely didn't mean any harm by it. It was not her being intentionally offensive or insulting. So I said, hey, no, that's not an appropriate question. And I kind of used the knowledge that I had to kind of push back. But there have been times that I failed. Recently as I mentioned, I went for my yearly exam, and then my doctor asked about mental health, but he kind of framed it as, I have to do the depression check. Do you feel hopeless? It was, and just really rough. And it was like, thankfully that wasn't an experience I was having, but if I was, I would not have felt comfortable with that at all. And I didn't say anything, and I should have. But I think that when it comes to bisexuality, mentioning, like I mentioned before, when doctors would say, do you have a girlfriend or do you have a boyfriend? Taking the time to say, well, for me personally, I am interested in this, but here's how you should frame the question. I have friends who identify this way or something, and just taking that time to say something about that, and just so that you're keeping that in your healthcare professional's mind. So that way, hopefully, if they do have another client, they will ask questions more appropriately. But just really in that moment, and I know it's uncomfortable, healthcare situations are uncomfortable even at the best of times, but kind of keeping your mind about you and finding ways where maybe you can use your allyship and have a conversation with your provider that they might not necessarily know to have with people who share an identity or might not necessarily understand. You can be the person that kind of takes that first step and makes them say, that's true, I should maybe be asking this question this way, or maybe I shouldn't be asking this question in certain situations.
Yeah, and I know that one of the comments that just came up on part of our chat was about the usefulness of having things like inclusive materials in the waiting room, inclusive materials in exam rooms, and materials that are inclusive of bi+ people. So it is not just gay and lesbian healthcare. We're not just looking at trans healthcare, but we are also addressing the specific issues in bi+ healthcare. So we only have a couple of minutes left, so I get to ask at least one fun question, which is, and this allows me to say a word that I just love being able to say, I would like to know who your current bicon is. And I learned this from Mackenzie. So I just like any opportunity to do it. Like Mackenzie's created her own monster. Helen, go. Who's your bicon?
So I have two answers. It's going to be Janelle Monáe and Sarah Ramirez. Callie Torres was a life-changing character for Baby by Me.
Good choices. Excellent, excellent choices. Mackenzie?
I really appreciate that you said current bicon, because there are so many, and then there's always more than I think. But I think since we're talking about healthcare, I think that currently Amber Heard and Evan Rachel Wood are two of my bicons, because they are both out bi women who have had to confront a lot of pushback when speaking out about intimate partner violence, and are just receiving so much disinformation and hatred. And it's just the fact that they are able to keep going is sadly inspiring for me.
Yeah, sadly inspiring is right, but you're absolutely right. Helen, Mackenzie, thank you both for joining us today. Thank you for the work that you're doing in this space too. It is something I don't think we can talk about enough, to be honest with you. So thank you. And Mackenzie, I know I will force you to come back and talk to me another day, but Helen, come back and visit us. Thank you, everybody. So that almost wraps up another episode of Something to Talk About Live. We will be back next week with another great show. Definitely check out those resources that we have listed for today's show, and definitely check out the resources available from PFLAG National. Just as a reminder, we have a pretty new logo and a pretty new website, so you want to check out pflag.org. While you're there, make sure you are also looking at our Read with Love program. And grabbing a great book. And the way you can check that out directly is pflag.org/RWL-book club. Our first meeting is actually next week. You might want to get yourself involved in that. Anyway, we wrap up the exact same way every single week, reminding you to do 3 things. The first one is run fast. The second is laugh hard. And the third one, which is most important, is to be kind. My name is Jean Marie Nevada. We will see you again next week on Something to Talk About Live. Bye, everybody.